So I'm more than pleased to introduce Indrit Bègue from the University of Geneva, who also represents the Swiss Brain Health Plan. Warm welcome. John Boyd, Vice President of Kaiser Permanente, all the way from California, I would imagine. Shiva Dustdar, Director at the European Investment Bank, a strong proponent and advocate of the brain economy for a number of years. Kana Enomoto, Director for Brain Health at the McKinsey Health Institute. Bill Heisel, who is ready to go, who is Director for Global Services at the Institute of Health Metrics and Evaluation. And last but certainly not least, Jan Schadrack, Global Head Neurology, Medical Affairs at Roche. So the brain dividend, what we mean by that is actually quite holistic. So we mean good brain health, but we also mean the readiness to engage in this socioeconomic life of the country. And we are facing a double squeeze because the prevalence of neurological disorder is growing, and we also have mental health conditions affecting younger part of the population. So this is a double squeeze. I don't know if you saw a very interesting column in the Financial Times about that this weekend, saying that people's reported good health is worsening, and the reason for that is largely due to the fact that mental health deteriorates and that people are cognizant of the fact that this is the case. So I would like to start with Bill, who is our number cruncher and main data scientist in the Brain Economy Group, to tell us about the scale of the challenge, first of all, that we are facing when it comes to brain disorders, and then, of course, also the scale of the opportunity. Bill.
Great. Well, thanks, everyone, for having us here today. The Institute for Health Metrics and Evaluation at the University of Washington in Seattle, for those of you who don't know, measures everything that impacts our health. So all the components of diet, the economics around health, education, and then all the diseases and risk factors that you could think of. And so when we talk about brain health, we're thinking about mental, neurological, and cerebrovascular. And when we measure the impact of brain health around the world, we do it both in terms of healthy years of life lost and in terms of economic impact. And so I'm going to show you if the clicker works. Maybe you guys have to click from the back there. There you go. So the total impact of brain health disorders globally is 3.9 trillion euros every year. And we measure that in terms of the direct spend on health and also in terms of the indirect costs. So the cost of the lost income to people who are experiencing brain disorders and the cost of caregiver lost income. And if you took 100-euro banknotes and you stacked them, they would cover the entirety of Sweden. If you're here in Belgium and you're thinking about what would it be like in Belgium, you could stack those 100-euro banknotes 15 high and cover the entire country. And that's every year. So you think about that kind of spend, that kind of economic impact, and all the things you could do with that money, all the good that you could bring to the world, and all the ways that you can reinvest 3.9 trillion euros every year. There's many, many more ways, better ways to spend it. And so one of the things that we want to talk about is not just how terrible that is and all the problems related to it, but also what are the opportunities. So the next slide, if you have a minute. So when we talk about brain health, people think it's a late in life issue, and that it's something that they don't really have to worry about right now, and it's something that they even want to put out of their minds because the thought of suffering dementia down the road is something that's terrifying to them. But the true impact of brain health happens across the life course, and we see a massive amount of lost health and lost economic opportunity in midlife, with people who are suffering from depression, from anxiety, from migraine, presenteeism and absenteeism. And again, if we can think about all the work we can do in terms of modifiable risk factors now, all the work we can do in terms of breakthrough therapies, all the work we can do in terms of prevention to unlock that potential and bring people back fully into the workforce, back into the brain economy, then we're going to see an even bigger opportunity. The slide didn't animate, which is okay, but what you would see there is a huge number of the economic impact related to direct patient lost income, and a huge related economic impact to caregiver lost income. You can go to the next slide. Then another reason for hope is what we know about the modifiable risk factors related to dementia. And if the slide were animating, what would be happening here is you would see that what we used to know was that about 45% of what goes into dementia was explained by modifiable risk factors. But what we can see now with our new emerging research at the Institute for Health Metrics and Evaluation is that it's actually 70%. And so that tells us that the vast majority of the risk factors that go into dementia are modifiable and something that we can actually do something about. And so I'll touch on some of those things just briefly, but low education is one of the simplest things that you can do. If we can just advance years of schooling, you can prevent more dementia. High blood sugar is super important risk factor, so everything we're doing in cardiometabolic is also important for neuro. And the last thing I would just mention is the effects of overweight and obesity. And so combined, we have the opportunity to intervene and change the course of the brain economy through just some of these simple modifiable risk factors.
So, Bill, because the figures got a little bit conflated here, so
Yeah.
because I guess there was supposed to be animation, but
Yeah,
so
yeah.
that goes from 45 to 70, right?
45 to 70%, yeah. So 70%, that's why it's all the way up to the 70% part of the brain there. But yes, 70% of dementia can be explained through modifiable risk factors. So I appreciate everyone's time, and I'll turn it over to the next speaker.
Great, thank you so much, Bill. This is the power of the numbers. I think we need to keep that in mind. By the way, we would like this conversation to be interactive, so whenever you have a comment or a question, please raise your hand. There will be microphones. We can bring them in at any point, not at the end, but at any point. So please let me know when you would like to speak. I'd like to come to Shiva next with a question. Now, given what's happening, both on the cost and opportunity side, what do you think explains the scale of underinvestment in the brain economy field? Because the underinvestment is a fact of life compared to other disciplines on the one hand, but also compared to what is needed, right? And also, how ready are we with the different financial instruments, such as the ones that the EIB deploys to face this challenge?
Thank you very much, and really great to be here with you all today. So I work for the Bank of the European Union, so the European Investment Bank. We're headquartered in Luxembourg. And in a way, what I would like to address is a bit the perspective as a public sector investor. And I think over the last few years, I've been indeed really struck by why it is that we are having such a chronic underinvestment in brain health. I spent a lot of years in my career at the EIB looking at infectious diseases. This is before COVID, where TB, malaria, and those in a way disease of sort of the poor, it was told at the time, and it was really a hard one to indeed, because of the market and the commercial returns, it was hard to actually get capital into it. What struck me with brain health is that there is a huge market, and every time I see William's numbers, I'm just struck by that the numbers are even increasing. So I think we're really dealing indeed with several very structural market failures. And I mean, in this audience, I think we're all kind of aware of them, but it's really good to put our fingers to it. I mean, one is indeed, a lot of the R&D that needs to go in requires long lead times. There's a high failure rate, and that in itself creates basically a huge risk perception. And with that, and that's sort of the second point, comes from a financial risk assessment, a very asymmetric risk situation, risk-return situation, meaning as a company, as an entrepreneur, you're taking a lot of the risk on your side. The returns are also societal. And this asymmetry actually is very much also what justifies very much a public intervention to kind of realign the return risk profile. But I think it is indeed a very important factor. And then, of course, there's a whole notion of prevention and all the prevention diagnostic work, which we are seeing a lot of those as costs instead of investment. I mean, in a way, the parallels are very much, again, when I look back at my infectious diseases time, the vaccines, why are we not investing more in prevention, in vaccines and so on? And I think COVID should have really been the wake-up call, given the trillions of economic costs that our lack of preparedness brought forth. It's interesting that for brain health, we don't seem to have the same sense of urgency. So if I look at it from a public sector investment perspective, there is really a role for banks like ours to become more intentional, more ambitious. And I see very often the parallels back what we did in 2007, 2008, when, for instance, we really were driving climate finance. At that time, also, climate finance was not something that was, or sustainable finance, very much on everyone's radar. And it was together with the World Bank and others where we, for instance, developed the idea of a green bond. And I don't know whether you've heard of those green bond instruments. They were actually very clever financial innovation, because banks like ours have to raise the capital in the capital markets. So we didn't reinvent that, but all we did is add a use of proceeds, meaning that when an investor would buy a green bond, we would basically commit to ensure that that money was used to be invested in green projects. And that, in a way, gave the investors a chance to sort of say, okay, my money goes towards such investments, and the EIB, in a way, had therefore a commitment to ensure that it would always look for more projects. So that also was an important commitment. But of course, there was a shared language and taxonomy, as we called it later, that over the years got developed. What is green? What is not green? What is greenwashing? What is not? So you may have heard me in the past. I mean, I do feel that hopefully financial innovations such as the green bonds could be developed in the future by municipalities and so on, because imagine all our pension money. Wouldn't we want some of that money to go towards brain bonds, or something that we would feel that it's going towards something that really affects us. So in a way, to wrap up, I would say we do have really structural issues that are very much at our hand. We have instruments. We have the public sector that needs to become more intentional, more ambitious. We have a lot of learning from the climate finance environment and the infectious diseases and all these other data. So the question is really what is holding us back, and I think it is really in many ways, I would say also from a public sector bank, we do need to also see more projects coming our way. We need to see more hospitals or social infrastructure projects with an intentionality of preparing for the brain economy. We need more R&D projects coming our way because it's obviously a demand and a supply issue. It's not just for us to say we're ready, but also having those. And I think this is where I hope that conversations like this create that awareness.
Great, thank you so much, Shiva. So we need more projects. We need to demonstrate that there is a demand for the funding. With that in mind, I'm going to come to Kana in a second, but yes, there is a question, so please, if you could come in. You could introduce yourself as well when you speak. We need a microphone. I need to share mine, yes, that's good.
Thank you so much. I'll be short. My name is Patrick Benson. I'm from Canada. I'm from Brainmark. Brainmark being pushing exactly everything you talk about for the brain economy the last 10 years, both in research and continue doing so. We are a private company, and we don't even imagine how we can go walking through the European Investment Bank and saying, hey guys, we're here and we would like money, because we've been trying, believe me. And so I really get what you said today. We need more projects. Well, here we are.
Okay, so the question is,
There's no is a question, and at the same time is like how we communicate. But today is the first time I met you, and we'll meet maybe later. But without things like today,
well, that's a start.
That's a start. But I'm saying like there's a lot of project around it.
Yes,
you know?
but I get the essence of your question, namely, how does one filter through the numerous projects which are out there? Because of course a lot of people like yourselves are doing amazing things and trying their best, right? So how does the funnel work, Shiva, so that the
Well,
back...
I don't want to be a party pooper, but the first step would be to set up a company in Europe, maybe, that can borrow. Because unfortunately your government so far has not joined the European Union, or is not a country where we have an agreement to be able to invest in. So, but but absolutely. I mean, I think companies like, that are developing whether anything in the health research front, we have venture debt instruments, patient capital instruments that are actually they have higher risk capacity, they are catalytic, they come in earlier, they stay longer, with you as a company, and they are less dilutive than straight equity. So all the good stuff. So maybe you should look at some.
Great.
Just choose one of the 27 countries.
Exactly. I mean, I thought Canada was actually drafting a membership application, but maybe it's not for the immediate future. So let's take one more question and then go to Kana. So if you could introduce yourself.
Hello, I'm Carol. I'm from Texas. Thank you, Shiva, for talking about your work. I had a question about one of the structural market insight failures you were talking about. How do you think we can address the perception of failure in terms of these new technologies that are being developed, specifically in the brain health space?
No, I think this is an excellent question, and indeed we have for years, I was heading at some stage our innovation advisory, and we were looking at why is it that not more investment is flowing in some of these high-tech, deep-tech, innovative industries? And we developed sort of a slogan which is still sticking with me. You need more finance in science and more science in finance. And with that, what we mean is you need, on the one hand, let's start with the scientific community. The more they understand how investors, and this is private and public investors, the more they understand how they tick, what they look for, how to actually present a very scientific project, nevertheless in a way that a normal person without a PhD in that field understands, and really speak the language of the investor. The more you bridge the gap, the better. And equally, of course, on the financial side, we do need also more specialized investors. I mean, for instance, the EIB, we do have scientists who also assess projects, because a typical banker would not, as you say, understand it. And if you don't understand something, you immediately see high risk, right? And I think it is really, therefore, on the one hand, having that. The other thing is, of course, and we do that with the European Commission in the European Union, of risk sharing, because a lot of science is funded by grants. And the case we have made over the years is that grants just leave and you never see them again. How about you put some of those grants in financial instruments so that they actually invest in, you can call it in either a repayable grant, in a forgivable loan, I mean in these very high risk instruments, because then the money has reflows, and this is something that also we believe will kind of create more finance.
Brilliant, thank you so much. This ties very well to what I want to ask Kana to speak about, because the McKinsey Health Institute is doing an extensive market sizing study in the neuro space. I know you don't have final results, but if you could reveal a little bit of what's coming up in your data, that would be tremendously helpful.
Thanks, Paul. And I appreciate, just want to give a nod to Shiva. Though she's focused on the EU, that's still quite a gauntlet to throw down, right? Like that is, for those of us who aren't EU members, but wish we were, it's still a tremendous opportunity, and I appreciate the EIB's focused in that direction. And while McKinsey Health Institute, and I think we have a slide, has been doing some analysis, but not of our data, but of our friend Bill Heisel's and IHME's data, but with a McKinsey analysis looking at, and we originally were calling it a market sizing, because that's typically what we do when we're doing kind of investment diligence, but in this case, we're including sources that are government, philanthropy, and private sector, and so it ends up being more of an investment mapping of where's all the funding coming from that is going into things that we would call brain capital. And so similar to, Shiva, the process you're talking about for the green bond, like what is green, what is not green, you know, what is brain health, what is a brain skill, what do we count as education, not education. For example, what's early childhood education? If it's just childcare without any educational component, it's not, OECD doesn't count it as early childhood education. As an example. So we did the sizing based on IHME, OECD, and other data, estimating that in the EU, the brain capital investment across brain skills, which is on the left side, so we have ECE, we have educational research, primary and secondary education, higher education, and adult learning. And then we have in the middle a very thin bright blue slice for promotion and prevention, which cross-cuts brain health and brain skills. And then on the right side, brain health. Right, so we have neurological, mental, and substance use disorders there. Overall, big picture, what we could identify was about $2.4 trillion per year being spent on across the brain health and the brain skills domain. So this is a huge market, right? If we're including, and it's dominated by brain skills, but this is including foundational education. And we went back and forth with our friends in education about whether or not those are, from a brain economy point of view, we consider all of education brain skills building, but we kind of landed on you can't separate it out. If you're learning math, if you're learning to write, if you're learning history, you're also learning critical thinking skills. You're also learning leadership and socialization skills. So total 2.4 trillion. And I thought, wow, that's really impressive. But do we know the population of the EU relative to the United States? Do you know? Population of the EU relative to the US? Twice, yeah, right? EU is twice the population of the United States. The investment is about the same. The investment is about the same. Now, it could be some artifact of we're better at capturing, at McKinsey, we're better at capturing expenditures in the United States than in the EU, just because of the data that we have available. But I was pretty surprised that in the US, and some of it is because in the US our healthcare costs are higher, right? We're spending about $40 billion more on healthcare. In the EU, you're spending more on neurological conditions. In the US, we're spending more on mental health and substance use. The investments in promotion and prevention from publicly available sources was about the same. So that really surprised me. So these are living documents. This is a living assessment. We welcome input from others that are happy to share it, but I think it's important to just have that first estimate. Like if we're talking about developing financial instruments, if we're talking about making smarter, wiser, more effective investments, I think it's important to have the landscape. And so this is already a substantial market as we see it, but I think we need to be aligning our incentives, right? Like we're clearly under-investing in research on both brain health and brain skills. We're way under-investing in promotion and prevention. And so those are where some big opportunities are for us. We're under-investing in early childhood. Now, I think, in the U.S. relative to Europe, I thought that it would be a much bigger investment in early childhood. But it's actually about the same. The numbers are different if I showed the US one because we count kindergarten in primary education, you guys count kindergarten in early childhood. But so across societies, we have an opportunity to invest more in earlier days. As Bill said, there's so much opportunity to prevent these conditions from ever happening. I think it's incumbent on all of us to advocate, educate, and make that happen.
Super, thanks so much, Kana. So that's very powerful. I can see two questions already to what you have just said. As you are getting the microphones, I'm curious whether you can tell us a little bit about the sense of dynamic, Kana, namely, are you studying also, is this the capturing of what there is at the moment, or do you also look at the dynamic of the situation? So that would be one question, but let's take one from the audience. So Tadeusz, yeah.
Thank you,
You could
Paweł.
introduce yourself, yeah.
Yes, so my name is Tadeusz. I'm the founder of the Psychedelic Access and Research European Alliance. My question is to Kana and maybe to Will as well. The OECD last week published a report called The Economic Case for Preventing Mental Ill Health. And there they have this estimate of the cost of mental health conditions, direct cost to healthcare systems of, I think, 76 billion euro. And we heard here, much bigger figures. And the message that got out is that it's the cost of mental health illness, but it's just depression, anxiety, and alcohol use disorder. So earlier, a few years ago, actually, OECD released an estimate of 600 billion euro, and this includes indirect costs. And there is a publication in Lancet co-authored by Saxena from former WHO that actually mentions that the costs are, in Europe, over 1 trillion. They operate in the range of GDP, which would be around 7%. So what do we make of all this? Because the OECD just released these figures, and they are a serious underestimate in my eyes. What would you how would you reconcile all these different estimates? Thank you.
Yeah, well, one thing I would say to that, and why it was so difficult for us to initiate this brain health work and do this economic analysis, it took us several years to do, actually thanks to our colleagues at Roche who helped fund that work, and the McKinsey Health Institute, and McKinsey was itself also part of that work. And it took so long because there are so many discrepancies out there in the underlying data. So you're really trying to go out and look at what government spend is, look at what health system spend is, look at private spend in the US in particular, and then you're also then trying to come up with a sensible way to estimate lost income. And so we tackled those things in phases. So we did the direct spend first, then we looked at the lost income to the patients, and then you had to do that next step on the caregivers. And assessing that, there's lots of debate about how you would do that, because some people might say, there's an argument out there, that a caregiver would have the maximum potential income, let's say, were they not a caregiver. But there's also the argument that you have to take a more nuanced approach, because people do have families, they do have these situations, so we can never assume that no one would ever have time spent caring for a child or caring for an elderly parent or caring for a spouse. So we take a more nuanced approach. We don't go to the maximum of lost income for caregivers. And so that's where you're seeing some of the differences, but it really is it goes with the foundational input data, that there's just so many different data points out there that you're trying to bring in, fix the coding problems with, and then create the estimates.
Thank you so much. So let's have one more question, and then I would like to go to Indrit next. So, yeah.
I will be quick. I'm Sharbani Chakraborty from Technical University Munich. And Kana, this is fascinating, and I hope you continue the work because I think we will learn a lot. Maybe a question for you is it only about more investment or cost-effective investments? Because in Europe, by and large, we have universal education. A lot of people have access to education, while in the United States, if I understand correctly, you don't have that. So when you look at equity dimensions, I think you would have to start looking at that and look at best buys and universality around education and healthcare. And I reinforce this is because globally we see an increasing trend towards not being interested in universality, and certain groups of the population are likely to be left behind. So just wanted to throw that out there. Thank you.
It is a great point. As we looked at the U.S. and the EU spend, in the U.S. we spend more, we educate fewer people, right? So I think it is true that it may not be particularly cost effective because we have, and then a greater proportion, of course, of the U.S. education spend is out of pocket or private pay versus government funded, and so and then, I think everybody knows it's pretty arguable that we have a high quality public education system in our primary grades. I think our universities can compete sort of globally, but our K through 12 really struggles in the US. So I think cost-effective investments are right. I think aligning the incentives on the investments that we have is also important because we are often spending more because of differently. I mean, we have fee-for-service, a fee-for-service health system versus single-payer health systems, right? The incentives are to deliver more care to sicker people versus more preventive care to keep people well. But you have places like Kaiser where, of course, that's not the set of incentives. So I think we have a lot to learn about making investments that are smarter, that are more cost-effective. I think the conversation about grant making, and it's the way we invest, how can we be smarter about the instruments that we use so that they are set up for sustainability versus one and done. And so, I think I encourage folks to look at the Coalition for Mental Health Investment. We've also done a lot of work looking at building off of some of what Shiva has shared, like what are the two valleys of death? What are the different instruments that could be used there? How could we look at the way we're using incentives to make our investments more durable, more profitable, but also sustainable?
Yeah, thank you so much, Kana. It ties very well to what I was going to ask Indrit to speak about, namely, the cost-effectiveness issue, the link between the burden of the disease and budgetary spending. I know that you have looked at that within the Swiss Brain Health Plan and in the Swiss context, and I'm very curious what's coming out of your findings.
Mm-hmm. Yeah, thank you very much. So we just pre-printed those data, so where we looked at how burden and spending are characterized in Switzerland, like what are the main drivers and how do they relate to one another. And I'd just like to throw a few numbers. Switzerland is a good case because it's a well-funded, well-resourced system. So if you find, let's say, difficulties in the Swiss system, I can let you imagine what happens in other less resourced countries. So we're looking at a very well-funded system that whose brain costs occupy 25% of all medical health. So basically, all costs arising from communicable, non-communicable injuries is around 92 billion in Switzerland, and 25% of that is coming from neurological and psychiatric disorders. So that's out of 4 francs, 1 franc is for one single organ. It's huge. And if you see the burden is not, let's say, uniformly distributed. So there are gaps. There are windows where you could intervene. But if you're looking at, you mentioned the link between burden and spending, which was our focus. Actually, it's surprisingly weak, inexistent. So basically, prior burden will not explain subsequent spending
and vice versa, previous spending will not be associated to reduce burden. And so these are burden and spending run by, especially spending, run by historical budgets. So there is no link, at least in Switzerland, about this, but this seems to be the case also for comparative countries that we had. And so we have a system that, first of all, does not respond to epidemiology, and that even if you increase spending, it will not buy you better health outcomes. And so, however, not everything is depressing. We have 2 cases where we are actually, we can illustrate the brain dividend in action. So basically, when you look at addiction, drug use disorders in Switzerland, Switzerland has been a pioneering country about addiction. So when you look at drug use disorders and suicide, you can see that the burden goes down and the costs go down too. So the medical costs associated are so effective that you're keeping your costs down, but also the burden goes down. So how do you do that? And that's why I mentioned the pioneering, role of Switzerland, because for these conditions, there are national strategy which are cross-sectorial. So they go in social, they go into schools. So things that are outside, upstream the medical system, but they result in 33 years of burden going down and costs going down. So I think that, of course, the challenge is now to see what worked for these conditions and try to generalize to other conditions, but this is a way that actually prevention can work. However, we need also to do it cross-sectorial, harmonized, in order to follow what Sharbani was saying, to follow cost effectiveness, because this is clearly not about just spending, we need to make it a valued investment. So the question that I want to finish is, okay, we are spending, we need more investment, but are we spending in a way that tracks this brain dividend? So, yeah.
Yeah, brilliant point. Can I ask you, because you mentioned prevention towards the end, and Bill showed us the figures, 45 going to 70, right? And I'm curious to know how important is the brain-specific part of the prevention effort. Namely, now we have quite extensive prevention efforts, some of them focused on the cardio aspects, but how important is it to focus on the brain?
Yeah, thank you. That's a very good question. So far, brain prevention has been seen as an add-on to cardiovascular. However, I'd like to gently push that paradigm. Actually, brain prevention is at the center. If you look at, for example, the modifiable risk factors for dementia, so there are 14 modifiable, they could be more, but they generally map into several buckets. So one is the cardiovascular, so you have hyperlipidemia, obesity, and overweight, and these things, which work. However, you have a bunch of factors, vision loss, social isolation, cognitive disengagement, which they don't have a cardiovascular equivalent. And there's another bucket, which is childhood adversity and depression, and all of these psychiatric factors that actually are not mapped when we are discussing brain health intervention. So actually, I would like to argue that that prevention should be brain focused, brain specific. And I'll give you another fact. For example, when you look at dementia, how dementia has been decreased over time, you could see that the magnitude of that decrease is around 4 to 6% over decades. So my question is, could we accelerate this prevention if we have mechanism-informed, neuroscience-informed prevention? So how can we leverage neuroscience to do specific brain prevention?
Yeah, brilliant. Thanks so much. I'm looking around if there are any immediate questions. Yes, Mika, please. So, just here.
Thank you, Mika Pyykkö from Finland. Maybe you guessed my question already that we are here to talk about brain capital, brain health, brain economy. But your discussion, it's a good discussion anyway, but it started from problems. Because for me, brain capital is something like an asset. You have heard me mention this already before, that we should really enhance our brain health, our brain capital. And if we don't manage to do that, we have some different kind of problems. Of course, there are problems which cannot prevent it at all, and it's important to take care of those, but I think that there's a huge potential if we really understand to enhance brain health. Kana a little bit touched that already, and now you ask about prevention. I have always thought that we Finns are so melancholic that we have to talk about prevention, that we can talk about how to enhance something good. But right. I think that you understand my message and my question now.
Yeah, I mean, this was a question or an observation from the point of view of the world's happiest country, Finland. So, of course, I mean, you're right. Well, at least in reports, you come out as the happiest. So, of course, you raise the bar for us, and it's true that framing matters, right? I do share that point of view that one needs to have positive incentives and not just look at the problem. And in that spirit of positivity, Jan, I want to turn to you to tell us a little bit about how that translates into the dynamic in drug development, right? The sense we have is that neurology and mental disorders are now super interesting with a high dynamic, 10-15% annual growth projected. That's what you get to see. I mean, how meaningful you think that trend is?
So thank you, and let me get back to Mikko. So totally agree with you. You know, it's not about only preserving brain health. I think when we do this better in the future, we'll even be able to enhance the brain skills, and that's maybe for future forum discussion. So anyway, my name is Jan. I am a physician scientist. I work in the pharmaceutical industry at the moment with Roche in Basel, Switzerland. All my life I dedicated to neuroscience. I'm excited about anything that contains a neuron and continue to be so. Yes, there is what we call an era of neuro-optimism again in the biopharma industry since recently, because there's so much scientific breakthroughs from basic science, because we now have the tools that can deal with the complexity in data science, in neuroimaging, in biomarker discovery, and continuously also learn how to do better clinical science, clinical research. I think it was already mentioned earlier that sometimes the investors are a little bit reluctant to, and also within the pharmaceutical company, to prioritize neurology and mental health condition versus, let's say, oncology or others where the risk of investment is less. Because in neurology you have lengthy, complicated clinical trial designs. They take forever. They're very expensive. And a prime example for this was decades of investments in Alzheimer's research and finding disease-modifying medications in Alzheimer's. And I think this tenacity, this resilience is starting to finally pay off, right? We have the first treatments available. There's now many company and many industry groups that return to investing in neuroscience. To the best of my knowledge, almost all of the big 10 pharmaceutical companies have a neuroscience portfolio again and a reinvestment in neuroscience. And also the trend of moving from the current status of reparative neurology. So most of our paradigms is based on fixing something that has gone broken. And that's very hard to do with an organ like our nervous system. So more and more it's about preserving or preventing. And so there will be an area to slow down neurodegeneration, but for this you will need better tools for early detection and to recognize pathology much, much, much earlier than we do today. Not when it's clinical, right? When it's biologically defined. And that's another great trend in neurology medicine. It's for the first time areas like Parkinson's disease have a biological definition. Alzheimer's disease goes from signs and symptoms to a biological definition. And we will see this year there's an increasing number of very well validated tools to assess in the lab your status of risk or your stage of neurodegenerative disorder. So there's a lot of innovation happening and a lot of optimism in that regard. And in terms of taking forward these trends will enable, let's say, better informed investments. And when you were talking a little bit about the challenge of the European Investment Bank, that yes, there's money, but we need more projects, one thought maybe would be that you create your own pharma company, and I think you would get a lot of attraction, because the combination that was mentioned, that we need to bring really financial acumen close to scientific understanding and vice versa, is a very important one. But the times are good. The outlook is really good. The scientific understanding of complexity, I think we have breakthroughs. And I think in this collective environment to really collaborate and learn from each other, we have amazing opportunities ahead, not only to reduce a problem, but also, to Mikko's vision, in the future, enhance brain skills. And that's maybe the era of synergy between human and artificial intelligence that lies in front of us.
Brilliant. Thank you so much. Yeah, it's very encouraging and powerful. And I want to go straight to John, because John is involved out there in running health care services in multiple U.S. states. So the question to you would be, how do you see this translated across the healthcare continuum, and where do you see the glimmers of hope that brain health would be addressed in a systematic fashion that I think this conversation calls for?
Absolutely. I really enjoyed the conversation with my colleagues and the meaningful questions. I'm with Kaiser Permanente. For those of you that may not know, we are the largest nonprofit health plan in the United States, largest integrated health system operating in approximately 12 states and consistently growing. What has set us apart in our history, going back to the mid-1940s, is our model of paying up front for healthcare, and then we become responsible for the total course of that person's healthcare. And oftentimes, our members stay with us for life. So I'm going to respond from that perspective. I'm also going to respond briefly in addressing a few of the questions from a perspective of serving as a California mental health commissioner for 15 years, chairing the commission and chairing the subcommittee on innovation for California. In the U.S., unlike other places, our government structures interact with the private sector in some ways that are helpful and some ways that really create barriers and burdens. One unique angle that I want to take in addressing this whole brain economy is actually the healthcare workforce. So I think it's true globally, especially true in the United States. We invest billions of dollars in healthcare training and education. And these are the stewards of the brain economy. So as an example, globally, there are over 2,000 physicians at least that die by suicide every year. Do the math, that's hundreds of millions of dollars. Nurses is in the multiple thousands. So when we talk about brain economy, from my perspective, we must start with the actual workforce that is protecting, supporting, and leading our collective brain health. And I think that is an important truth. It's especially true at Kaiser. I think that starts with medical education. We have our own medical school. So are we actually educating and training our physicians to be true stewards of the brain economy? At Kaiser Permanente, approximately 300,000 employees throughout the country. We are responsible for our collective healthcare and our collective mental health and brain health. So designing things in the workforce, suicide prevention, addiction, those things that impact all of us, well, when they actually emerge within the caregiver setting and with physicians, the cost is actually billions. If I shift to our members, We have the ability to go as upstream, I think, as any other healthcare delivery system. Prevention, early intervention, increased screening, and parallel to that, making sure we have the infrastructure to deliver and to meet not only the members' needs, but the caregivers' needs. And so those are really the main points. I think from the perspective of a California mental health commissioner, I really appreciated, I didn't catch your name, but you really talked about meaningful investment in this space. And I think that is also a different component of preserving the brain economy. I think we have the privilege of living during a time where stigma has been eliminated more than it ever has. We still have a lot of work to do on that front. There's also a lot of competition in this space called brain economy. Competition amongst for-profit, nonprofit, VCs, a lot of innovation. But the best way that I believe that we can be good stewards of this brain economy now is making sure that as we innovate, as new products and new opportunities come to market, that we actually are creating a seamless experience for families and individuals, that we don't have an ongoing bifurcated system of protecting and serving our brain economy, which unfortunately has been too oftentimes the case in terms of how behavioral health has grown.
Yeah, thank you so much, John, especially for underlining the importance of those who are out there providing the interventions and how well trained they are and in what good shape they are is, of course, of vital relevance. Now, I would like to finish this opening discussion by asking Kana to bring this into the broader economy and productivity context. Because when we say brain economy, brain health is the foundation, but we want to build human flourishing on that foundation. And in the Human Advantage report, you have studied that link between resilience and performance in the workplace and human flourishing. So if you could tell us in a nutshell how you see this working out in real life.
Right. Yeah, so in our report that McKinsey Health Institute did together with World Economic Forum, and then so many of you who are in this room who are part of the Brain Economy Action Forum and others, we looked at the different levers for the brain economy. And there is the safeguarding brain health, fostering brain skills, and investing, studying, and mobilizing. I think one of the sectors that we need to mobilize, or the stakeholders that we need to mobilize, are employers, because so much of what we learn, the skills that we develop in early childhood, the biology that we develop when we're in utero and as we grow, and then the brain health that we foster and maintain over the course of our lives, they have an impact on how we show up at work, whether or not we're present or whether or not we're absent because we have disability ourselves, whether or not we are caregiving for others. But in the age of AI, right, like it's not just the presence or absence of illness in ourselves or others, but it is the way in which we lead, the way in which we have empathy, the way in which we can exercise judgment, critical thinking, creativity. And employers in the C-suite, leaders in the C-suite, I think, are increasingly realizing that if they're not paying attention to growing brain capital in their own organizations and in their communities, then they are going to fall behind in the race for leveraging technology and AI. And as my colleague Jackie will speak to later today, we are better understanding, it's an emerging field of study, obviously, but we're better understanding that interface between the human, the agent, the robot, right? And then different kinds of teams. And we have to perform differently. Our brains need to be trained differently, supported differently, and protected differently so that we can be as productive as we need to be, that we can learn at the pace of change that's coming not only today, but also, 3 months from now, 6 months from now. We can only imagine how much faster AI is going to evolve and change the way we work.
Great, thank you so much. Any final questions or comments from the floor, please? Yes, so can we have the microphone?
Thank you. Hi, I'm Naomi Glover. I'm an applied neuroscientist, and I'm working to try and create what you're creating in Switzerland here in the back in the UK. I wonder a couple of questions briefly. Whether any of the statistics and the data that you're looking at has come from the UK, because obviously we've kind of cut our own limbs off in Brexit, and we're really keen to try and work with you because you've got so much expertise in this area. The European Brain Council have been incredibly helpful already, and Mika too. And then just in terms of the workplaces, most people in the UK have not come across the concept of brain health. When they have, they're thinking about it in terms of dementia, and so we're trying very much to turn that around. But cognitive health in particular is completely missing in workplaces. So they think about mental health and they're conflating the things, that the challenges that I'm hearing from people in the workplace are, I can't focus, I have brain fog. These are issues that are cognitive issues, but they're not being addressed by the fixes that they currently have for mental health. And I wondered if you have any ideas on how we can address that. Thank you.
Actually, we have an entire session on that, it's the last session of the day. It's about a brain positive organization and brain positive workplace. So this is when we will discuss how to bring these different elements of positivity together. So yes, mental health, brain health more generally, also built environment, how do decisions about the design and space of work influence the brain health. So let's maybe take it up in the final session, if you don't mind. Warm thank you to the speakers for opening the summit with a wonderful exchange on the brain dividend. I find this to have, going back to Mika's point, a lot of positivity built into it. It is about dividend, so it's about something that we get out if we invest early enough and if we invest properly. Thank you so much for joining.